Good evening, everybody. How are y'all doing this evening? It is a beautiful day, or it was a beautiful day. Still is. We're still on this side of the grass, so it's always going to be a nice day. Welcome to the Ladies Lounge with Wonder Lowe. I'm your host, Wonder Lowe, and I have a very, very good guest with me tonight. A great show, some great information. So make sure you get comfortable, grab you something to drink, get all comfortable, and get you a good seat and pull up and pay attention. We're going to be talking about something that is we can consider to be an epidemic right now. We think about a lot of times we talk a lot about COVID and we talk about everything else that's going on, but we have not addressed this one particular thing, and that's teen mental health care. So let me read just a short introduction to you. Well, first, let's do some housekeeping. So if you haven't been tuned in before to the show, thank you for tuning in tonight. I know a lot of people watch the replay. A lot of folks don't tune in right when we're live, but that's fine too, as long as you watch it. If you are, make sure that you share the video, you share the link for the show, and make sure that also share this with people that need that information. Because, like I said, we're talking about teen mental health, a mental health crisis, and we want to make sure that we educate and empower and encourage people to live better lives by providing information that helps them to do that. So, let me give you a little bit of background. So, as we continue to wage war on obesity, diabetes, cancer, infectious diseases, health disparities, environmental health concerns, smoking, alcoholism, physical inactivity, and more, public health is becoming even more important to increase the well being of our communities. The public health field is focused on preventing disease, prolonging life, and promoting healthy lifestyle choices through organized community efforts. The fact is, public health is everyone's responsibility. The enormous task of protecting and improving public health calls for collective collaboration, communication, and creativity of federal, state, and local public health partners. For us to swing the pendulum on old and emerging disease threats, we must all be open to out of the box ideas and collaborations. This includes educating, empowering, and engaging youth so that they are vested in their health and the health of their community. It means educating youth about wellness, empowering them to address the upstream prevention and management of chronic conditions, and engaging them by providing opportunity to act. Mumford and Associates is a minority-owned, woman-owned public health consulting firm founded in 2018 by Quinyatta Mumford. Mumford and Associates LLC provides relatable health education and promotion services to aid in addressing the health education gap within the healthcare system. In 2018, Mumford and Associates LLC primarily worked with clinicians to meet the health education needs of clients diagnosed or at risk of developing chronic disease. However, in the height of the pandemic, they shifted to focus on training non-clinical professionals to fill the education void of the healthcare system as a result of limited human resources. In December 2021, Mumford and Associates sought to address critical needs of youth. Mumford and Associates adopted youth mental health first aid and has since trained more than 300 non-clinical professionals in evidence-based curriculum. After seeing measurable success, Mumford and Associates sought to expand their reach to directly impact youth. Now, I know it's a lot of introduction, but that kind of gives you a little bit of background and sets us up for the conversation that we're going to have tonight. So tonight with me, Tiffany Hicks, and Tiffany is a new member of Mumford and Associates, and she brings a wealth of knowledge and compassion to the organization. Ms. Hicks has a BA in sociology from Ashford University, and during the time she finished her degree, she wrote several papers on the effects of societal norms of policies that affected our youth, as well as their chances at success in the future. The pipeline to prison, as well as how treatment of our Black and brown girls and boys by the school, faculty, and their peers, either in discipline, classroom interaction, or academic expectations, affected them academically and mentally. These issues are very important to Tiffany, and she knows the increase in mental health in the past 2 years. We need to fight this battle before it gets to the schools, and more of our normal. Children think normal violence is normal to resolve problems at school. So, Miss Tiffany, thank you so much for taking time to come to the Ladies Lounge tonight and talk to us about teen mental health. And I want to give you just a couple of minutes to kind of tell everybody a little bit more about yourself. Anything you want to share can be. about, working, or it could be about coming to Arkansas or your family, whatever it is that you want to share with us tonight.
Well, I have three children, and when COVID hit, I had a junior in high school, a freshman in high school, and then a seventh grader. I really saw the impact of COVID with my two youngest children. My junior in high school
Mm-hmm.
loved being home, loved being away from school and doing all of her classwork and hanging out with her friends. So for that aspect of COVID, being having her be home did not affect her. My younger two, the lack of structure and having them be home and have to rely upon their computers and headphones, listen to classes to check in, that affected them. And so I really saw the impact with not having the interpersonal relations with their peers and with their teachers, and just having to get to know their teachers through a computer. It was hard for them. And being home for that whole year
Mm-hmm.
and almost half of the next year in 2021, because by then my sophomore was a junior and then he was a senior um, the following year. The senior year of high school was a bit of a struggle for us because we saw the impact of him not going to school, for him not going in the classroom for a year. He still did fine on his grades, but the impact affected him. And
Mm-hmm.
the just seeing that made me realize if he's affected, he cannot be the only one that was affected by the lack of interpersonal
Yeah.
relations, the lack of teachers, the lack of administrators, because we all need to realize that administrators and faculty members and even the lunchroom ladies have an impact on our children's lives.
Mm-hmm.
And just, I mean, they're small things and they become big things, and our kids need that interaction. And so,
Yep, that's true. Now, I will say, I've talked to several people. I had some teachers on. It's been a couple of months ago now. And actually, in last year, we did a whole show about the impact that the pandemic has had on
yeah,
students or just
yeah,
kids in general.
yes,
And about how when they finally did come back in the classroom, a lot of kids, things affect everybody mentally differently.
right,
And if you think about an adult is impacted by having to quarantine and you're not out with your friends, we weren't going out to eat, we weren't hanging out, we weren't going to the movies, we weren't doing anything. Well, if it affects an adult, then it affects a child.
yeah,
And I'm like,
yeah,
they don't have that classroom interaction. They don't have that one-on-one or that face-to-face with their teacher. The kids are still struggling. So
yeah,
I went to grandparents day last week with my grandkids. And one of the things that we talked about, even at that grandparents day, I talked to one of their teachers, and she was just saying how the kids are still struggling
yes,
because know, you're still having to use a Chromebook or still having to have that internet interaction. And
yeah,
I'm like, why are you still doing that, sitting in the classroom with somebody? So it's still a little barrier to learning because a lot of
yeah,
kids didn't have or
no,
guardians or whoever
no,
at home to still support them getting an education. And they just had to wing it.
yeah,
So they were just out there on
yeah,
their own, and it's very hard for a third grader or somebody who still needs that nurturing or that hands-on to have to sit in front of a computer and figure out how to get their work done. So
yeah,
what y'all are doing at Mumford and Associates, what Q is doing is wonderful because kids do need outlet, but adults also need to learn how to deal with those kids. So let's talk about this. What drives you as the newest member of Mumford and Associates?
what drives me are today's kids, because today's kids are tomorrow's leaders, and if we don't help them cope with life when they're in high school, because a lot of the skills that you learn in high school from being in the classroom and being in your peers is you learn coping skills, you learn interpersonal skills, and when you don't have them because of COVID, it's hard to grasp them, and so a lot of our kids are a year and a half behind the curve of learning how to cope with their peers. And so we're seeing that in the classroom, the way kids are interacting with their teachers, the way they're treating their teachers, the way they're treating the faculty, the way they're treating their own peers. Those coping mechanisms are
Mm-hmm.
affecting them. I mean, there was I know recently there's been an issue with kids in schools just not respecting teachers. Well, if you haven't really seen a teacher in a year and a half, you don't, and you weren't taught that as a child, you don't know how important it is, because when you disrespect a teacher, she loses teaching time, which means the other people in the class who want to be there or who don't want to be there think, well, I can do the same thing and let me follow suit. And so then the class just spirals out of control. And that's what we have to bring back. when we bring those kids back and they're able to cope in the classroom, they're able to listen, they're able to focus on, okay, I'm in class because I have a goal. My goal is to get
Mhm.
out of high school and go on to college, leave college with a degree, and set myself up for for an amazing future. But when you have kids who didn't know how to cope, who are leaving high school, who are then going to college, you're having the same problems that our kids in high school are having. I mean,
Mhm.
this epidemic, this mental health epidemic of our kids is not just affecting the high school kids, it's affecting our freshmen and sophomores that are in college right now because they were
Mhm.
COVID teenagers. They went through it
Yeah.
themselves and then they got jumped into college. So this
Mhm.
coping skill, it has to start with these high school kids. We've got to teach them how to talk to each other, how to really handle when they're having anxiety issues because our kids are having anxiety issues. They're having issues of ADD that that did not manifest until a lot of ADD does not manifest until you're in third or fourth grade, and then sometimes it gets really
Mhm.
bad when you're in ninth and 10th grade. And if you're not diagnosed ninth or 10th grade, it's 10 times worse when you're 11th and 12th grade because you don't know what you don't understand why you can't sit and do the work. You don't understand
Mhm.
why you get frustrated and when your frustration leads to this rage that you cannot control. And that's a mental health crisis.
Mhm.
ADD is it's a all of my kids have it, and I've always told them it's a quirk within your personality and in the way you learn. And we manage to work around that. But the kids
Mhm.
that don't understand that almost use it as a crutch, and they don't need to. They just need to work around, and they need to learn to work within their abilities. And so this program is trying to get together with kids and bring the kids together who need the help and have them bring their friends and their friends realize, okay, I can cope, I can deal with these issues, and I can learn how to be a better citizen in my community and to bring my peers into this so we as a whole are a better community members within our own schools, which is really what that's our main
Mhm.
goal is to affect the entire school so the school environment is more conducive to learning and more conducive to having great high school memories. We want kids to leave high school going,
Yeah.
okay, that was a great experience. Not I hated it, I don't want to go
Mhm.
back, I'll never see this place again. And so, which is what we don't want. Because I enjoyed my high school
And that,
time.
yeah. But these kids, and I understand what you're saying, because if you'll think about, and you just hit, well, it's too many points. I can't say all of them. You hit the nail on the head when you said the babies that are going off to be freshmen and sophomores in
Yeah.
college right now are the COVID teenagers because they didn't
Yes.
have the
Yeah.
traditional last couple of years of high school.
Right.
So there's something to be said for missing. Most people go, well, you already know what you need to know. You're ready to go off to school. And to a certain extent, that's true. But
Yeah.
they missed that last year and a half of having that face to face interaction with their teachers, of
Yeah.
having that face to face with their peers, and just enjoying an open life
Yeah.
like we've been before, and being able to go to football games or basketball games, do all that different stuff.
Yeah.
So
Yeah.
now, when you're telling them to buckle down and study, they have to learn how to do it a different way.
Right.
You know what I'm saying? Because you get that last little bit of oomph in your senior year that
Yes.
kind of carries you through your freshman year of college.
Right.
Well, it's kind of hard to get that if all I've had to do the last year and a half was stare at a computer screen. So
Right. And
unless you are already a highly disciplined person, it's very
right.
difficult for you to make that leap once you go into college.
And that's it. It's the kids who are highly disciplined who are able to maneuver and go off to college, but the ones who are not disciplined are the ones who are having the issues. Those are the ones.
Hmm.
Well, I saw that with my own two children. My one child was
Yeah.
highly disciplined. Being not being in the classroom was no problem for her. My middle child, he had a little bit of an issue, and he wasn't disciplined like his sister was, and so that was like a big turning point for him. But he did make the switch when he went off to college, where he did see the effect of not going to school in the classroom for his junior year of high
Hmm.
school. What he saw this year because he's a freshman this year. And so,
Hmm. So yeah, so it makes a big difference. So let's talk about the Health Conscious Youth Program. Tell us how that program is helping kids to make that leap and to get some kind of understanding of what's going on with them.
okay, so the program participants for this program are 9th through 12th graders, and they'll earn a certificate in the Youth Community Health Worker Program. They'll participate in health education and promotion sessions throughout the school year. We're actually going to start our program at Parkview High School the week after Thanksgiving for 9th through 12th grade girls. We're starting with girls first. And we're asking them to partake in a service learning program that extends through the summer, in addition to educating them and empowering and engaging them, because we really have three key principles of what we're trying to give them. We want to educate them and how to handle life, how to empower them to have the skills, and how to engage them so they can talk with their peers and be able to talk to other people about the importance of education, and then the empowerment aspect of it all. So, and we'll equip the Little Rock School District personnel and parents with the same skills so they can serve as a bridge to address the mental health needs of the youth that they serve and that they love. Because if we can't get the parents on board, it's hard to get the kids on board, or keep the kids on board. And so that's been a big goal for us. And since the start of COVID, families worldwide have undergone an extreme financial hardship. They're either underemployed or they're unemployed, long-term social isolation, and intense distress. These compounding stressors affected our kids, as we were talking about, through emotional and behavioral issues, including risks for maladaptive means of coping with pandemic-related distress, such as self-injury, substance abuse, and disordered eating behaviors. And so in 2021, the Center for Disease and Control conducted the Adolescent Behaviors Experiment Study. And so they studied a certain number of children, then a study group of children, and they wanted to see what was really happening to these children who were COVID children. And they discovered that these children had a higher incidence of disruptions and adverse reactions during the pandemic, including parental and personal job loss. Some of these kids were the breadwinners of their families, and they lost their jobs because they were home, and a lot of people didn't realize that there were some kids who worked to buy their family food, because we always saw the teenage kids in the grocery store and in Sonic and in Burger King, and just thought they were working for little pocket change, but some of them were not. So when things shut down for a month, they didn't know how to feed their family because they were the breadwinner.
Yep.
So and some of these kids, their families suffered with homelessness, with a rising hunger. I mean, we were a state that we had kids that were at risk for hunger issues. Our hunger issue kids had gone up. I mean, we were kind of stabilized, but it went up because of the pandemic, because everybody was what's the word I'm thinking of? It's not hunger poor. It was food insecurity. It was food insecurity. Our food pantries were not being restocked, and so these kids are having emotional and physical abuse either through their parents or through they were self-harming themselves, which is awful. And they had difficulty completing their schoolwork. I mean, as you were saying, a lot of these kids didn't have access to computers or tablets, and you would go to your library to use your library's Wi-Fi. I think that's probably one of the best things that we did. Our libraries were staying open. We had school buses that were going around to neighborhoods and setting up a Wi-Fi for these kids in these neighborhoods that didn't have access, that they could use their tablets and do their homework as long as they were near the Wi-Fi that was on the school bus, which I thought was an amazing thing that we did as a school district to help the needs of those kids that were going to have a hard time just doing their classwork. And the school buses apparently would stay in those areas until probably 8:00 at night, which was nice, because if those kids had to go to work, they would go to work in the morning and then come back and do their schoolwork. Because a lot of the businesses that were essential businesses were staying open, or were opening up and staying open because they were essential businesses. So a lot of teenagers who lost their jobs in fast food were able to go work in grocery stores and Walmart and drugstores. So
now I tell you what, I didn't know about the school bus thing, about them coming around with the Wi-Fi.
Yeah,
that is interesting. I didn't know about that.
Yeah, I know
Hmm.
in Little Rock School District they did that, and that's also why a lot of your schools were also offering meals. The kids had to come in, and they
Hmm.
could come in and get a bag meal for breakfast and for lunch. And a lot of your libraries offered the same
Now
thing.
that
A
I
lot of
remember,
your, you know, you were saying
yes, I remembered the food.
yes,
So I said, oh, I remember the food part,
yeah,
but I didn't know that they did that with the Wi-Fi. Because
yeah.
I know I
I didn't
worked with an
realize,
organization ago
yeah,
that we were talking about how most people don't know that the majority of Arkansas does not have access to Wi-Fi or
yeah,
any internet systems in those areas. So
yeah.
we have one of the lowest rates of connectivity across the country. So the
And they
kids that are
realized that. So
mhm. So now you see, you'll see a lot of construction and stuff going on now, and they are putting out fiber optics to
yes,
get us better connected because
yeah,
it's odd that you would think, well, people have phones. Well, yeah, a phone is one thing,
yeah,
but you
man.
can't do all of your homework on your
No,
phone. I mean,
no, you
tried
cannot.
it.
No,
So just
you can try.
yeah,
So
it's not gonna work out too well, but but at the
no,
same time, it's better to have that access to Wi-Fi and have some
yeah,
way that a steady connection for kids to be able to do their work.
yeah,
So you talked about why that program is important, and I totally agree with you. There's so many things going through a child's mind, particularly like you said, the ones who are the breadwinners for the family. They're providing
yeah,
food. They're providing. A lot of them are helping with shelter because they're making money to pay rent.
yeah,
And you're right. And I don't think that that was something that was taken into consideration at the very beginning of the pandemic because you don't believe or you don't really realize most of the time that kids are actually in the roles of adults,
yes,
and they some kids have adult issues. Some kids are the only parents that their siblings know,
yeah,
and they have to get them something to eat. They have to make sure they have a roof over their head. They're buying the clothes. They're buying all of the supplies.
yeah,
So that's enough in itself alone
yeah,
without a pandemic to cause a
yeah.
crisis. So let's talk some more about the program. So tell me more about the social emotional learning and how it relates to health conscious youth.
Well, today's technology and dependence on social media have lessened our children's ability to have interpersonal connectivity because kids have learned or kids have believed that the number of likes, the number of dislikes determines who they are, and it doesn't. I mean, you talk to kids now, and I'm like, "Do you talk to your friends in class?" No, we text. Well, why do you text? Remember when we were in high school, we would fold up our notes like a football and pass the football to our friend or play the game, and flick the football to our friends. But kids
Mm-hmm.
today don't understand the importance of one-on-one talking. I mean, they don't know how to talk to each other, and we're discovering that because of the dependence on social media, they're not realizing this is the skill, and then they're leaving. They're going into the workplace, and you're hearing about managers who are having to deal with adults who are in their 20s who are crying in their office over something as minor as, "Oh, she took my pencil." Like, well, you're an adult. You went through high school and college. This is not something that you cry over. But these kids can't cope because social media has taught them how to be adults, and it really is. It's not a good thing. If we could really pull our kids away from TikTok and Instagram and get them to talk to each other, I think it would be better. Because they lack
Yes.
they lack this healthy self perception of themselves, and this positive self perception, and this affirming social perception. And I think one of the things I actually do love about social media is I love how now we're having our music stars and our TV stars who are teaching our girls about positive body image, and how it doesn't matter how you think you look, it's how you believe you look. And if you believe that you look amazing, you look amazing. It doesn't matter
Mm-hmm.
what shape your body is, as long as you can look in the mirror and go, "Look, I look beautiful. I'm happy with what I look like." And I think that's probably the only good thing I think about social media, because I do like how our celebrities are realizing these girls actually look at me as an influencer. Let me teach them what I didn't get in high school. Let me hope that they get
Mm-hmm.
this in their high school, and they see it's okay to have a different body shape than my mom or my best friend or my grandmother. I can
Yeah.
have self-love, and I can wear what I like because I love myself. And I think that's a good thing. I think I really see, I really, you can see it when you're around the girls who love themselves, and the girls who are still hiding within themselves because they don't realize you're beautiful just the way you are. And
Yeah.
so, because these kids feel isolated, and they still feel alone even though they're back in school, which is so
Hmm.
disheartening to me, because these are the moments that they're going to look back on and think, why did I feel so alone in high school? Why did I think I wasn't worthy in high school? Why did I think I had to hide myself? I wish I could understand why girls, really, it's more girls to me, because I have two daughters, and I've seen the effect of them thinking they're not beautiful without realizing you're beautiful to me because you're my baby and you're still my baby. You'll always be beautiful. But do you see what I see? But some girls don't see that. They didn't have a positive role model that told them, oh, you're beautiful, oh, you're smart, oh, you're funny. I think that's
Hmm.
I think that's where the disconnect is. So I think part of our program is helping these girls realize that you empower yourself, because when you believe in yourself, you believe in your education and in your future, you're able to do what you need to do in this world to make to make you a success, not other people around you, but to realize that I'm responsible for my success. But in order to see myself as my success, I have to believe in myself. I have to empower myself to go out there and do the steps I need, you know, to get my voice across
Hmm.
in the right way, in the positive way. You know.
And I think just tagging on what you said about social media being such an influence on our kids now, and that's one of the things that's the biggest problem, is that there are, let's see how to put it. The world says that beauty looks one way,
Right.
and we say that beauty looks another way. And the weird thing about kids, and not necessarily a weird thing, but the thing about kids is they're going to go with what the world says.
Yeah.
They're going to look at the pictures. They're going to look at the people that are on social media, their photos that are airbrushing or whatever you call it when you make it
Oh
look
yeah.
way better than what it is. And that's the concept that they get stuck with. So they start
Yeah.
thinking, well, I'm not beautiful. I don't have the right hair. We have this huge, ridiculous issue with hair.
Yes.
If your hair is straight, it's a problem. If it's not straight enough, it's a problem. If it's
Yeah.
problem, if it's coiled, it's a problem. We have so many issues tied to our hair. Then we have to look at what makeup looks good, and then what clothes look good. And I'm like you, what if my body shape is not the same? Then we had the BBLs. I'm not gonna go into that because y'all know what that is. But we have so many different issues coming at us that it's no wonder some of these girls are stressed out,
Yeah.
because it's too many different things out there the world says that looks good, and then when you look in the mirror, you don't see yourself in all those
Yeah.
different things,
Yeah.
and you
Which
don't
is
need
really
to. You need
unfortunate.
to see who you are. Yeah,
Yeah.
and it's stressful. I mean, if you think about it, even at my age, I know women that are, and I'm in my 50s, so I know women that are in their 50s and they still have body image issues.
Yeah.
We still have
Yeah.
an issue with, oh my God, my hair is not this, or oh, my body is not this. So it doesn't go away. And then the weird thing is something strange. You have people, even like I said, women in their 50s that are still looking at social media. You're not going to look like that 20-year-old.
No.
You're
No.
not. Now, some of us look very young for our age, and we have
Yeah.
not aged roughly, but we're
Yeah.
not going to look 20. It's
No.
just not going to happen.
No.
So,
Yeah.
if you're struggling as a 50-something-year-old, think about what that 20-year-old is struggling with. And then the
One of the things.
disconnect in,
Yes.
go ahead, go ahead.
Um. When I was a Girl Scout leader, one of the things I did was I give all of my girls a mirror. They were probably 10 or 12 years old. Perfect time to do this. I gave them a mirror. I said, okay, you have a mirror. I want you to take a piece of paper. I want you to write down what you see. And they all wrote down
Mm-hmm.
negative things. I said, now I'm going to go around and I'm going to write down what I see. And I wrote down only positive things because I wanted them to realize I may see negative, but other people see positive. And doing that
Mm-hmm.
lesson, it taught them I'm more than what I think I am, because I'm showing the world what they want to see. And I taught them to realize when you get up in the morning, you need to look in the mirror and say to yourself, I am enough. Because a lot of
Yep.
these girls don't realize they are enough. you know, they can do stuff
That's
to to enhance their beauty, but they are enough without having to do you know the hair. I mean, I work for Ulta as a part-time job. We sell
mm-hmm.
eyelashes out the door, and I'm thinking, why do we see so many eyelashes? But our girls, our teenage girls are doing eyelashes now because they think they're supposed to. I'm like, you're not really
Yep.
supposed to. That's okay if that's what you want to do. So I see the impact of social media and what it's doing to our girls with the hair and the eyelashes, and even the foundation colors that they're choosing, and the
Yep.
makeup colors that they're choosing, and just it all trickles down into our girls' self perception. I think that's probably one of the good
Mm-hmm.
things I love about this program is that because we teach these girls that the skills that they need to empower themselves, they will one day realize, okay, I don't need everything to feel beautiful. I have enough because I've been given the skills. So when I look in the mirror, I see that I am enough. A little bit of makeup,
Mm-hmm.
a little bit of hair doing, it's enough. I don't need to do so much of it that you can't see who I am. I see wedding pictures now of women who put on all this makeup. I'm like, that didn't look like you 5 minutes ago. Who is this person? I'm just like, this is not you. This isn't. I mean, yes, they're beautiful. Don't get me wrong, they're beautiful. But I never
Yes.
understood how you didn't look like you who you were 5 minutes ago. And I mean, this is across all color barriers. It's not picking on any
Mm-hmm.
particular women. It's all women who do
It's
this. And I
everything.
think we're teaching our girls that you've got to completely change how you look to be beautiful. I'm like,
Yeah.
no, you don't. A little lipstick and a little mascara is all you need when when you're 16 years old. You don't need to put on a full face of makeup because you're not dealing with wrinkles and enlarged pores. You're just dealing with, beautiful skin. So,
Yeah.
um,
This is
there's a part.
some of the transformation the makeup transformation
Yes,
videos,
yes,
and they start off showing you a person, but then the makeup goes on, and you go, "Where'd that person go?"
yes,
Because it's so
yes,
much. I mean, I'm like you. If it changes, if I can't recognize you when you put makeup on, I'm gonna go with you. Probably have on too much. I should
yes,
still know it's you under there. I should still be able to recognize you. Because I see
yes.
people that have on stuff and I'm going, I know what you really look like, and that's not it.
That's how.
And
Yeah,
it, to me, my friend jokes all the time, that is just false advertising. I'm like, yeah, because somebody's gonna get a really big shock when you wash that off. Because
yeah.
you're not gonna look like
No,
the same. But that's what's out there, what our young girls are looking at, and
yeah,
that's how they're thinking they're supposed to be. So
yeah.
yeah, it's a lot.
But
So
we
talk about
educate
this.
these
Okay,
girls.
go ahead.
Um, one one of the things we do with this program is we educate these girls. We have a health conscious youth program that replicates a program called Teen Outreach Program, and it's an innovative,
Mm-hmm.
evidence based program that builds social connections among high school age group youth. It promotes a positive development of adolescents through curriculum based interactive group discussions, positive adult guidance, support, and community service learning. Because our main goal is to each of these girls come in there uh, and they join our program, and we ask them, okay, you know what? Tell me what you're passionate about. And these girls have amazing. I mean, some of these girls may be passionate about animal welfare. Some of these girls may be passionate about the homeless children. Some of them may be passionate about after school programs. But we ask them all, pick a pet project and decide how you want to do this project. What are the steps
Mm-hmm.
that you want to do? How do you want to go about it? I know one of our young ladies is really big into pageants, which I think is amazing because
Mm-hmm.
I know pageants get a bad rap. They really, if they're done right, they're done right. And women don't see them the way we think they would see them. I don't know if you noticed, but this year's there was a pageant, a young lady from Harrison, Arkansas that won. Beautiful young
Mm-hmm.
lady. Well, I saw her in person at um, Skin Center, and I looked at her because she was also with Mrs. Arkansas, another black female. I looked at her in
Mm-hmm.
person, and I realized she was barely wearing any makeup. And I thought, you
Wow.
were showing our little girls that you don't have to use all this coverage to be beautiful. You can just be beautiful with the skin you're in. And that was one of her
Mm-hmm.
big ticket items. was that she wanted girls to realize that they could be beautiful in the skin they're in. I thought this is what we want our girls to see, and I loved that because of what it said. It's I mean we try and teach our girls that that's important, but we want them to realize that there's so much more. And so when these girls choose these pet projects, they have to come up with the plan. They've got to come up with how many hours a month or week that they're going to spend volunteering with these programs, and then they come back and they talk about these programs. And so they finish off their year program with a certificate or some sort of reward to show that this is what I've done. And they can go on and add this to their resumes, because these girls are going to go off to college. And when they go off to college, they've got to be ready. Colleges are now asking for resumes with the applications. And these girls have to be able to write a resume and talk about what they've done in school, what they've done, volunteer-wise, what they've done educational-wise. We've got to have those three components. And a lot of these girls are not doing volunteer work because they're not realizing, I need to volunteer work as well on my resume, and they do. And so we teach them how to write the resume so it showcases the best of who they are. And so it showcases these are the key points of who I am as a person, or I would be an asset to your college, and why I'd be an asset to the girls in your college, because I am enough. And I think that's amazing. I think when we teach girls how to use their own self and how to educate themselves and how to empower themselves and how to engage others, it shows a lot more than just what you see. It's just it's a great thing. And so the top program is focused on several key issues. It's focused on adolescent health, development, including building social, emotional, and life skills, developing a sense of self, and connecting with others, which is where the volunteerism is coming from. Because you have to go to those volunteer places and tell them, I would like to volunteer. And you never know who you're going to see every week, because it's a different person every time you go. When you're volunteering at the shelter, when you're volunteering at the animal shelter, it's never really the same staff, because they have to rely upon a group of volunteers. So our girls have to learn interpersonal skills away from the social media and away from the TikToks. They have to learn how to talk to people. And I think for that, it gets the girls to realize, it's not just me, And these weekly meetings are about 45 minutes. And within those 45 minutes, the groups are no more than 25 girls, no less than 6 girls. And they meet once a week. And so the curriculum is divided into 3 areas: the empowerment, the engagement, and the education. And so they all work together for the same core group of helping these girls realize that they can do it all, that they can take it out into their world. So I love that.
Okay. That sounds like it's a great thing for them. It gives them another outlet and another sense of a support group, for them to gather with other young ladies that are working in the same areas or working on the same issues. And they're getting empowered together, they're getting their education together. So that's forming a new sisterhood for a lot of those girls, and giving them, like I said, a better support group, so that they have somebody to know that they're not alone, and they can go to the group and talk. So that is wonderful. All right. Talk a little bit about, let's see. Did we talk? Oh, we did. We have not addressed you all do a program on mental health first aid. So let's talk a little bit about that, because I've talked with you about it. It's been a while ago, and I kind of wanted to get an update on, what was going on. I know at the time she was planning on doing some trainings, and I believe she's already done those. So talk a little bit about your mental health first aid program.
The mental health first aid program, it covers the common signs and symptoms of mental health within our youth, including anxiety, depression, eating disorders, attention deficit disorders, the common signs of substance abuse that our kids are dealing with. It also teaches them how to interact with their peers or with another adult. So we want to teach the adults how to recognize the signs, how to recognize when our kids are dealing with issues. And so we want to connect with the youth, and we want to expand the content that kids are dealing with trauma through either home trauma or work trauma or peer trauma, substance abuse, the self-care. The girls are now, self-care has become one of those buzzwords, and I understand the importance of it, because self-care is important. And if our girls don't realize it, they're never going to, it's going to be harder for them to realize You gotta take care of me in order to take care of. It's like the airplane. When the plane's going down, who's supposed to put on the mask first, the baby or the parent? Well, you've got to realize I put on the mask and then I put it on someone else. And if I don't take care of myself, I
Mhm.
can't take care of everybody else. And
Yep.
so, and with the impact of social media and bullying that we're also addressing. Um, we're engaging students in public health by providing opportunities to develop work-based skills and to explore public health as a career pathway. Because a lot of these girls don't often know what they want to go to college for, and sometimes this gives them an out. Oh, I like sociology. Oh, I like psychology. Oh, I love counseling. I love talking to my peers.
Mhm.
But how do I go? How do I get a degree in that? How do I then help my classmates? How do I come back to my school and work in my school? Because I loved my school. I loved all the faculty. How can I come back? And so we teach them, you go to school for this, and then you go to school for this, and then you come back and you work in the school districts and you work with the schools that you see need your assistance the most. And so,
Mhm.
um, um, and we asked them to explore public health as a career pathway because, according to the American Public Health Association, community health workers are frontline public health workers who are trusted members and have had a usually close understanding of the community. A lot of your social workers that are in your classes that are guidance counselors, a lot of them either live in the community or they know where the kids are that need their assistance are near the school. Your guidance counselors, a lot of children don't
Mhm.
realize your guidance counselor is form, your first form of a positive adult. At least they're supposed to be. That's who you're supposed to go to if you have a problem with your teachers or with your peers. And some schools do an
Mhm.
amazing job of addressing these issues. Some schools,
Mhm.
probably still need some help, but a lot of them do a great job. There's a relationship that enables the what's the hold on. I forgot what this buzzword means. Let me find my paper. The clinical health worker. There's a relationship between the
Mhm.
clinical health worker to the community. They're serving as a liaison, a link or intermediary between the health and social services and the community to facilitate access to services and to improve the quality and cultural competence of services delivered. Like a perfect example is there's a program called the Princess Project. That's really a social program. It seems like it's just a program to get kids formal wear, but it's really the impact of having those girls come in who couldn't afford a formal dress to go to prom or a cocktail dress to go to homecoming is so much more than we think it is because these girls come in. A lot of these girls come in and they're just beaten down because they're like, I need a dress. I feel embarrassed about coming here. And then they come there, and these women that run these programs see these girls need to feel pretty, need to realize we have
Mhm.
everything that they need. And when they leave out of there, they're on cloud nine because they realize I have everything that I need. And they've taught me how to do my hair, how to put on makeup, how to walk in my heels that I'm now getting from them. And because
Mhm.
of that, these girls will then give back. They'll either give back the dress or they'll learn to give back another dress for another girl. I mean, every person that you touch the first time gives back to two people. We've discovered
Yeah.
that for every girl that gets touched by by social network, this magnitude gives back two times, which I love to see that.
Mhm.
That is just that's amazing.
Hmm.
And
That
so
is
these
amazing.
girls, you know, um, this is a sidebar. I realized that I did a program where I did capes for homeless children, and I challenged my
Mhm.
Girl Scout troop to make two capes for the homeless children. Instead of making two capes, they asked for more material. Each of my girls made 5 to 10 capes for all of these children. We got there
Wow.
with 150 capes. I thought we would have some left over. We had no capes within 20 minutes. It's like didn't the girls didn't
Oh.
realize the impact of doing those capes. And these were
Mhm.
10, 12-year-old girls who realized that little thing that I did affected that little boy or that little girl just because I
Mhm.
told them that they were worth it. And here's a cape that says, you are a superpower. Your superpower is whatever you want it to be. And so that's a
Mhm.
sidebar. Um,
That's it. Uh-huh.
so I love that. During the summer of 2016, 2017, 2018, Morehouse School of Medicine, which I love this idea, with the support of the Atlanta Regional Collaborative for Healthcare Initiative, piloted and implemented an innovative high school community Health Worker Training Program. This program was the first in the country to be implemented. They thought that high school students could provide vital health information to their peers, um, in the underserved community and within the population. The program has achieved such great success, and it's now modeled and sought after in other school districts and other universities and other community-based organizations. The program, the we the Morehouse program is now the Community Health Workers program, has been going on for at least 10 years. Initial programming was developed in Georgia. To date, the Morehouse program has founded over 350 community health workers to work in a variety of settings, communities, clinics, academia, and healthcare in areas of diabetes and cancer control, reducing the emergency room visits from frequent flyers and increasing the number of children and adults with insurance, which is just, I mean, because we see with kids that don't have insurance, it becomes a problem. We don't realize it, but it really
Mhm.
becomes, I mean, even dental insurance. If you don't have a dental insurance and you're not going to the dentist once every 6 months, your teeth can erode away. And when your teeth erode away, it affects your blood, it affects your skin, it affects
Yeah.
a lot more than just your teeth. And so
Mhm. Mhm. That's a
we are,
self-esteem issue and some other things.
yes, yes.
Mhm.
And when you're a teenager and you're missing teeth, you don't smile. You don't really. It becomes a trickle down effect. Um,
Yes.
we have objectives with this training program that we're trying to meet. One of our objectives is increase the number of trained student community health workers, provide health careers, pipeline program for mentorship for underserved students, support and promote the community health worker field, promote health education and health literacy in schools and communities, assist trained high school community health workers with the design and implementation of school-based and community-based health initiatives, provide health monitoring and health literacy. A lot of our schools, before you go back to school, will do a community-wide um, health fair. So we want our
Mhm.
girls to work these programs because they'll see the impact of them doing these programs. Because a lot of these kids that come to these health fairs don't have health insurance, don't see a dentist, have not seen, um, even just seeing um, a salon where a hairstylist. I mean, those are all health
Mhm.
and self care environments. In order to
Yeah.
achieve this program requires 160 hours of classroom instruction during the school year, September through May, 40 hours of field
Mhm.
instruction during the summer months, and additional hours of continuing education in the school year. The summer intensive program is held every week. It's held Monday through Friday, August and July, from 8:30 to 4:30. That's our goal. And so
Mhm.
the community health
Okay.
program during the summer, students work in groups to brainstorm and develop a community or school-based health project to be implemented during the school year in conjunction with the local community-based organizations and school partners. Like with you have the school partnership that works to bring the flu shot and the flu clinic to work with them, bring that about. During the
Mhm.
monthly session, students receive training in human-centered design principles. The student groups are guided through the inspiration, ideation, implementation phases of these programs. So when they leave, they're they're ready to go. We also have a family
Mhm.
community health monitoring program. We're trying to get our
Okay.
families together, because there's always a chief medical officer of a family. There's always one. It's
Mhm.
either mom, dad, big sister that's always responsible in collecting, um, the birth certificates, the social security cards, the shot
Mhm.
records, just all that vital stuff. There's always someone that knows. Okay, if you have a doctor's appointment, we go here. If you have this appointment, we go here. It's never
Yeah.
fails. There's always someone. Um, they benefit from this program because it helps with improved overall family health and fewer hospital stays and less visits to the emergency room, and providers with less readmissions because of non-compliance to the trained students, and they're prepared to work in the health field.
Mhm.
So,
Okay. So you all have a lot going on at Mumford and Associates. That's look, I think what we talked about 4 or 5 programs. So that's
Hmm.
quite a bit you to do to help, and you're not just helping teenagers. Now we talk about about the teen mental health crisis, but we're also talking about um, continuum of care, because you're talking about helping not just that teen, but you're helping that whole family. Because if the
Right,
teen is the root, or is the person who, like we said earlier, is the breadwinner, who's the provider, who's the person who kind of takes care of everything, and they might be the CMO of their family.
right,
Excuse me. The programs that you're offering actually not only just take care of that kid, but they take care of that whole family. So
right,
you take a holistic approach to how you're helping people, and I think
right,
that does a lot more for a family, or it does a lot more for in that family than anything. Is that when you can take um, look at the whole family and help everybody,
yeah.
because it kind of takes the burden off that teenager. So how can organizations get involved with Mumford and Associates and all the things that y'all have going on?
Well, we would love to youth serving organizations to come talk to us if they're interested in partnering with this to partnership with the Health Conscious Youth Program. And to the teens that we serve, we'll provide training and oversight of the program in collaboration with the youth serving organization. They can email me at Tiffany N. Hicks at Mumford and Associates, and I'll get them all the information. We're
Mm-hmm.
about to start a program at Parkview High School on Thursdays from 4 to 5:30. Registration is
Okay.
open now. I think you have the link. And so,
I do, and I can try to post it. Hold on, let me see if I can get to it, closing everything.
I mean, we would love
Uh,
me. I would
oh,
love
okay.
to have more women come
Get
talk
to
to
my.
our girls because our girls need to realize women, not that they run the world, but they have such an impact on everything that we are doing. I mean, they're women
Mm-hmm.
scientists, they're women engineers, they're women that are building cars. That are designing our future. And these girls need to realize, well, if she can do it, and I believe I can do it, I can follow my dream, and I can do this too. I mean, I have a friend of mine whose daughter is in neuroscience. She's a neuroscience major, and her goal is to study the effect of strokes on black men and women. And I was like, that's really something that we need to know because we don't know the effect of strokes because strokes present differently based upon your race. The same with
It
skin.
does.
The same with skin. I mean, black skin and white skin look totally different if they have the same effect. And a lot of people don't realize measles does not look like the way it looks on black skin as it does on white skin. And if you don't have someone that actually knows what they're looking at, you can be undiagnosed for years because someone doesn't know. And our girls need to realize, okay, I can do this. I do have a passion, for following in science. I do have a passion for following in engineering because I can help somebody. And I love that. I would love to have more female-owned businesses come talk to our girls, and realize that, okay, you know what? You can do this. You can do this.
Mm-hmm.
I know in the past, a lot of our female-owned businesses have brought in. I know of some female-owned businesses that have brought in girls as interns during their summer breaks, where they learned the business from the
Mm-hmm.
ground up, and they went on to college, and after college came back to work for those businesses because they saw enough when they were in the business that they believe in that business. And so I see a place for myself right here in your business, helping you get your point across. And so,
Okay. So, so you got the Parkview Teen Outreach Program. It's going to be on Thursdays from 4 to 5:30. I'm
yes.
trying
And
to
then we have,
post that link, and I have to get out of when once we finish with the broadcast. I'll go back on my page
yeah.
and post that link, because I think it's
And
so
then we're,
long. It's not
yeah,
fitting. Right.
we're working on a Saturday program as well, a Saturday teen outreach program that should hopefully start
Okay.
in the springtime. And so we'll go, we'll know more about that in the upcoming months. And so, I mean,
Okay.
there's a lot going on. We're trying to meet as many people as possible. Because we realize this is the point where we've got to reach these kids now. Because if we don't, and they go out in the world, we're going to have some problems, and we've got to help them cope now. You know.
Mm-hmm.
See that that they have the steps, and if they don't have the steps, it just takes one step for them to realize, okay, I can do this. I can pass on this to someone else, and I can be good. So,
Well, I think what you all are doing is absolutely great. It's necessary, um, not only just for the kids, but also for the parents and the other family
yeah,
members that are around them. Because again, if you help that child, you help that teenager develop those coping skills, then it's something they pass on to younger siblings, and it probably calms down the whole household. Because
yeah,
again, sometimes those teens are the people that are the heads of their families, and they have a lot of stress on them between trying to go to school and be a kid and all these other things. It's hard enough without the stress of having a job or being in a food secure situation or whatever. So I think that helping those teens learn those coping skills and get them to a place where they're very conscious about what's going on, and they know that they have some places they can go and they can talk. They have their peer groups, they have the meetings that are going to be coming. I think that that's going to do a whole lot to help a lot of these children, because our times are not getting less stressful and more stressful.
yeah, yeah,
And that even as an adult, we need all the help that we can get, and it pays for us to go and talk to somebody sometimes and have groups like yours or organizations like Mumford and Associates who are working to help kids to get those particular kind of life skills. So we got a couple more minutes left. I want to give you a chance to say to add anything that you want to add. Also, when we get off, if you'll send me that flyer for the Health Conscious Youth Program, I'll be sure to post that to
okay,
my page and share it and make sure we get that out. If there's any upcoming, do you all have any upcoming trainings or anything happening? Because I know we're getting to the holiday seasons, which is a
okay.
whole nother level of stress.
Oh
So
yes.
just tell us about that real quick.
Um, about the, oops. Okay. I think I lost my train of thought. I know. As we close out this meeting, I want people to remember the three E's. We want to educate, empower, and engage our kids so they can talk to each other, so they can build each other up, so they can empower each other, so they can use the skills that they learn to take it out into the world and to bring it back to the world, and so they can teach other girls the three E's. If we just remember the three E's in our life: educate, empower, and engage. Those are such good learning skills and good coping skills, because it's
Hmm.
always the little things that become bigger things, and you don't realize that the little thing that I did, it's a trickle down effect. I mean, it's like the girls in the prom dresses. It's a little thing, but to them it's a big thing, and it snowballs into a bigger thing. So as long as we continue to do do that, I think it would help out. Um, there's supposed to be a Sunday program. I just saw a message from Q. There's a Sunday program that I'll send you the information on to put on the website. It starts after Thanksgiving. It's for girls 9th through 12th on Sundays. I'll find out more about it and send that to you for
Okay.
sure. So, and once
Okay.
again, my email
Definitely.
address, if anyone has any questions, is Tiffany N. Hicks at Mumford and Associates.com. Mumford is
Mhm.
Mumford and Associates.com. So it was so great talking to you. I love having other women talk about our girls and talk about the importance of our girls. And it's not, I mean, yes, right now the focus is our girls, but it's also our boys. I mean, our boys are struggling
Mhm.
as much as our girls are struggling. And
Yes.
sometimes we've got to start small to get big. And we've got to start with our girls and then hopefully bring our boys in, because boys are a different breed than girls are. I mean, they learn differently, they react differently. I mean, you just can't do the same thing I would do with the girl. I couldn't do with the boy. And as a mom of one boy and two girls, I've learned that lesson. They do not learn the same way. They do
Hmm.
not react the same way. It's just totally different.
They
So,
do. We have
yeah.
two and two, so I believe me, I know. Yeah, it's an experience. I tell you
Yeah.
what, as a parent, it does teach you balance, and it also
Yes.
teaches you to look at things and look at them a little bit differently, because
Yeah.
you're right. The boys do not think the same as the girls, and
No.
sometimes things that girls get, boys don't get. So
Right.
yeah, you have to. It's a different kind of way you have to communicate with them, and it's actually a different kind of way you have to listen to them. So
Yes.
yeah, it's it's a challenge sometimes, but it's been a nice.
Yes.
Well, thank
Now
you,
with
ma'am.
my adult children.
Go ahead.
Excuse me.
Oh, I was just saying, thank you so much for visiting with me tonight, and thank you for all of the information.
You're welcome.
Again, make
You
sure
have
that
to
you
come
send
back.
flyer. Yes,
Okay.
definitely. What we're gonna do is I'm getting ready to change my format a little bit. So once I change my format and kind of get it settled again, I was out. And everybody knows I've been off for several weeks now. I literally said I'm earlier in the year. I said I'm gonna take a break. Now, when
Yeah.
I meant take a break, I thought I was gonna take a week off. I took all summer off. So I hadn't done a show. I did one, I think, one last month. And then, I've had some health issues and there's been some little challenges along the way, but I'm ready to get back started. And I said I was going to change my format. So definitely after the first of the year, when you all have any events going
Yeah.
on, if it's anything ever that you want me to share or to post, make sure you just
Okay.
send it to me and I'll be sure to do that. Because I
I
do want
will.
to this year, going into 23, we are going to, yeah, it's 22. For some reason, I keep thinking it's going to be 2024. I'm jumping ahead too fast. So we're going
Yes.
to 2023. Yeah, I'm a year out. I'm already a year ahead of everybody. Starting in January, I know they're going to change format. So once I do, I'll make sure that I let everybody know. We'll get back talking and get regular
Okay.
again, going because there's so much information in these last couple of months with different people I've been talking to that I really want to share with everybody. And I want people to be able to get some, get. You see, I have 3 E's too, and mine are educate, encourage, and empower. So
Yes.
make sure that we do that going forward in 2023 in the latest town. So again, thank you so much for your time tonight.
You're
I had
welcome.
to thank you, Miss Taylor. Thank you so much for y'all coming on and or you sharing information about Mumford and Associates. I appreciate y'all.
Okay. Thank you. Have a great week.
All right, you have a great rest of the week too.
Okay.
All right,
Bye.
y'all. All right, bye bye.
Bye.
We will be. Let's see. Getting ready to go into the holiday season again, like we said earlier, and I know this adds another level of stress for a lot of people. Pray, meditate, take a moment if you have to. If you have to get your, I was gonna say eggnog, but we're not doing eggnog just yet. Okay, some of us not doing eggnog just yet. If you need to take a break, take a break. Holiday season, like I said, is a whole nother level of stress for people. I get stressed out around the holidays because I want to cook a million different meals and I don't have the ability to. You get worried about family members, you get worried about different people. It brings back memories of loved ones that have passed on, and it makes it kind of tough. So, from me to you, take care of yourself. Take that moment if you have to, breathe if you have to, rest if you have to, step away from it if you have to, but do what you need to do to protect your peace and protect your mental health during this season. So I won't be back next week until I won't be back until December. So happy Thanksgiving. I hope you all have a great holiday season. I'll be back a little bit later. We'll have another show. Like I said, our first of the year, we'll do a different format, but we'll have some more great guests, some more great shows. Thank you all for sticking with me all this time and for all of the followers, all of the likes, everything that you do to help the Ladies Lounge with Wonder Lowe stay on and popping. I don't know why I want to say popping, y'all, but I just want to say it. But thank y'all anyway. Have a great rest of the night, and I will see y'all after Thanksgiving. Don't eat too much turkey. Bye bye.